If I touch seats, that's the way to go.
I'm not accountable for that. Just the messenger.
All right, well, welcome everyone. I'm Stanley Brown. I'm the Dean of the Decolonizing School of Public Health. Look, I had a little bit of anxiety this morning when I looked at the weather, whether or not anyone would actually come out for this, and I'm really glad that you're here, so thank you. But let me start with the land acknowledgement. If I could just have your attention for that. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Okay, so let me talk about some positive things. This is the 5th annual Vohra Miller Lecture. And so a number of years ago, Vohra Miller gave the Vohra Miller Foundation, and particularly Sabina Vohra Miller, gave the foundational gift to the Institute for Pandemics. And in some ways, both the gift to the Institute for Pandemics and the topic of this lecture is a topic very near and dear to her heart. So for those of you who know anything about Sabina, you may know that she is the person behind Unambiguous Science, which is a whole sort of social media enterprise dedicated to driving out as much evidence as we can. In these times where we kind of cope with misinformation and disinformation and trust and a growing suspicion of expertise in all its forms, it's important to kind of see folks who are championing evidence. Because at the end of the day, whether you go back to Virchow's original sort of quote about what public health is, or you look at more modern kind of thoughts about it, it is still very much this idea of expertise, thoughtful, critical reflection, advocacy that come together in a way to make people healthier. Let me talk for a second about the Institute for Pandemics that her and her husband's gift helped establish. So, folks may remember, they may not want to remember, but folks may remember that we have gone through a pandemic recently. It was something that was only supposed to kind of happen every once in a while, and I was thinking about one of my colleagues the other day who was the White House advisor on COVID near the end of the Biden administration. He said, I knew we'd have a pandemic, and I think in a moment of very good scholarly honesty, he said, I didn't know it was going to be like this. And so the whole idea of being better prepared, not just for the onset and anticipating when it's going to happen, but how we manage through it and how we recover it is central to the theme and the mission of the Institute for Pandemics. And something I'm really glad is housed at the school, and the leadership of the Institute, Nelson Lee and Ted Kanye, where's Ted, are here today with us, and I'm really grateful for that. Let me talk a little bit about the topic. So misinformation is rampant. It is associated with deteriorating trust. For folks who've kind of looked through all the kind of behavioral research on this over about the last 45 years, social media and all these things are set up to mislead us. And I don't mean it's intentional, but we're attracted naturally to things that are novel. We're attracted naturally to things that have a dramatic impact. We're attracted to things that are different. And actually most misinformation, disinformation is different. It is dramatic. It is surprising. It does have that sort of emotional content. But when you look at it, it travels a lot faster through the internet. I think the study I saw was 20 times faster when they've sort of looked at it, kind of working it through. And that's what you'd think would be an unbiased or maybe a contrary biased source. That's actually engineers who were at Twitter at the time who've done some of that research. And so it's interesting to see just how fast and how deadly it can be. We're going to be talking today about building trust in health through culturally aligned artificial intelligence. This is actually in some ways a very counterintuitive topic. Whenever we talk about AI, we say that AI builds in and reinforces the biases. Maybe we can actually change that around. Maybe we can actually think about how all of these technologies function as they should be, which is as a tool and not as a distorter. And I'm really, really grateful that we've got Kate Mulligan here. I've got some sort of normal notes about Kate, that she's an assistant professor here and everything else. What I will say is that I bring Kate into one of my classes every year because she is remarkable at being able to take evidence and create evidence and actually turn it into action as well. And so to be kind of a double threat like that is a remarkable good thing, and she's actually an excellent teacher too. We're joined by Jude Kong, who is with us at the Decolonizing School of Public Health. Jude is a remarkable scholar. If you ever feel like you're kind of running out of energy, I suggest you figure out whatever it is that Jude is living off of, because he is constantly in motion doing wonderful things, whether it be working with kids north of the city to get them into coding, get them excited about things like health and math at a young age, whether it be kind of leading a whole bunch of epidemiology across sub-Saharan Africa, or teaching and just being a phenomenally productive researcher. So I'm really grateful for that. We've got Ishtiaque Ahmed, who's come to us as well from the University of Toronto, and if you go through his website, you'll start to develop a sense of insecurity about your own sort of accomplishments, but it is very profoundly this idea of how you engage from a computer science perspective with AI in a way that was ethical. And we've Dan Lizotte here as well, who's come from my hometown, so I'm particularly biased and grateful that he's here from Western to talk to us, again, about this issue of how we navigate these challenges, and not just in a reactive, but in sort of a very thoughtful, proactive, and I hope purposeful way that can inform not just the discussion today, but also some of the opportunities we have for changing what's going on. I'm going to do my favorite thing as a dean right now. I'm actually going to get out of the way because I am the least qualified person on this stage. I'm going to sit and actually get a chance to learn something. So please join me in thanking our Kate and our panelists today, and I hope you enjoy this.
Thank you. Thank you so much, Dean Staney-Brown, for those very kind words of introduction for everybody here on the panel. And thank you to everybody who is in the room here today, the East Common Room at Hart House on the University of Toronto campus, and those of you who are joining us online in the live stream. And as a reminder, this is also going to be recorded and shared with closed captions on the University of Toronto's various streaming sites. So that is a way that you can help continue to share the conversation beyond this evening. Okay, so just a little bit of housekeeping before we get started. Our program today is going to include a roundtable with reflections from our panelists, and we will ask some questions that were submitted in advance by those of you who are watching online. And we'll take questions from the audience. There is a microphone at the back of the room, so start thinking about what you want to ask about culturally aligned AI and building trust. I want to begin by recognizing that, first of all, I don't know anything about AI. And maybe you might be feeling the same way. And so there's a lot to learn from these experts about how we can do work with AI that is aligned with things that we do know about, in my case, community health and health equity and community development. And so those are the kinds of things that I'm going to be coming in with an interest in. I want to recognize that to build on our land acknowledgement, that we're also on Dish with One Spoon Wampum Belt territory, which is a pre-colonial treaty under which we all share responsibility for the land and life on this land or in and around the Great Lakes region. And one of the reasons I want to mention that is that that treaty crosses borders. And this is a really important time for us in thinking about crossing borders in and around the Great Lakes with our neighbor to the south and around the world, and also to celebrate some really good leadership here in Canada on issues that matter to us. I happened to be on the Toronto Board of Health as a community member during the crisis component of the COVID pandemic, and really saw in real time how important it was that we had strong local community social infrastructure and resilience. And that's something that this very tailored approach to culturally aligned AI can really help support and strengthen so that we have resilient communities. So once again, I want to thank all of you for being here today. We have Dr. Dan Lizotte, Dr. Ishtiaque Ahmed, and Dr. Jude Kong. And I'm going to invite each of you to take a moment to just tell us a bit about who you are, what you do, and what does culturally aligned AI mean to you? Can we start with you, Dan?
Thanks very much. So I think I'll continue on with what you were saying about crossing borders. So my name's Dan. I'm very grateful to be here and to be able to have this conversation with my awesome colleagues and with you. I'm faculty at the University of Western Ontario in computer science and also in epidemiology and biostatistics. And I teach in our Master of Public Health course. And I just recently became the director of the Rotman Institute of Philosophy at Western, which is an institute that supports research about philosophy in conversation with science, both of those disciplines very broadly construed. And I really think that interdisciplinarity needs to be a key strategy for addressing this issue that we're going to talk about today. So when I was reflecting on the issue of culturally aligned AI and what that might mean and how we might move forward with it, or not, if not appropriate, I was thinking about two things that we talk about with our Master of Public Health students. So one is relationships, and the other is systems thinking. So I'll talk about those briefly, and then we can move on. So I think that what we're about to talk about today is a wicked problem. It is not the kind of problem that is addressed by a single person or a single discipline or a single department or a single university or a single country. I think that, being that I believe that to be the case, relationships, professional, personal, are going to be key for resolving this question. And I think that we're still, let's just talk about academia for a moment. Like, I think we're still trying to navigate what the relationships need to look like in order to support researchers who want to tackle these wicked problems that they will not tackle by themselves. And that will not be one person with their multi-million-dollar grant that they are going to get it and it's going to solve this problem. And so we need to really think about the incentive structures if we want to talk about research, on the research side, that really genuinely value interdisciplinarity and they value relationship building and maintenance and using that as our springboard to success. The other thing I wanted to talk about was systems thinking. This is a catchphrase, if you like, that we talk about with our Master of Public Health students because public health is hard. Like, there is a lot going on. There are so many factors and organizations and contexts and situations and groups of people that if you come to public health and you really espouse the values of public health, which equity is at the center, public health does not exist without equity. Then if you want to move on that, it's another case where thinking about only one of those pieces, you will not move the needle. You may move it a little, but you will move it far further if, as you're working, you are thinking about all of the elements of this system and how they play together to lead to results that we're either happy with or unhappy with. So that's very general, but I think that those principles, I really want to hold those close tonight as we discuss this because my colleagues would not do this, but sometimes there's a tendency to fall into what people call techno-solutionism. And I think it's really important that we acknowledge and respect all of the expertise that exists in public and population health already for solving lots of the problems that we are going to talk about. So thanks.
Thanks, Dan. Ishtiaque?
Thanks. Yeah, I'm Ishtiaque Ahmed. I'm an associate professor of computer science here at University of Toronto. I work in the area which is called responsible AI and human-computer interaction. So what I do is I build AI systems that are responsible. What does that mean? And how is that related to all these public health conversations that we are in now? So when COVID-19 it started, then we also saw a lot of a spike on social media. People were attacking different groups for spreading this virus. There was a spike of and pardon for my a use of technical words like a spike. So there's a lots of posts on social media at people attacking people from certain countries or certain faith groups for spreading the virus or criticizing certain practices there. So we got a grant to find out what are these hate speeches and can we identify them automatically, because manually finding them, flagging them, taking that out, it's not possible. They're coming in millions. So I was building this algorithm, and so for that, for AI people in this, the way AI system built, you take data and you need someone to level the data. So there were, tweets like this. People were criticizing Chinese government, and then we had 14, people who were leveling the data, which means annotating the data, and they were given a hate scale. So on a scale from 0 to 10, how hateful do you think this, this particular tweet is? And we found that some people, some of the annotators, they say it's not hateful at all. We Chinese people, we criticize our government all the time. How is it hateful? And then there are others were saying that, no, this is actually hateful because they're saying that right now because they are pointing to something and they're putting that in other contexts. So at that, and this shows the subjective nature of artificial intelligence, which sometimes people think that it's an objective science, it's kind of techno-solutionism. There is one objective way of looking at it, but it's not. And then we at that point, we felt the need of actually sitting down with the community leaders. So if this is the community who is now at risk of this public, an attack or hatred online, how do you want to, address these issues? So for the next 2 years, we had series of conversations of different groups and subgroups within these communities to understand what the problem is, who are the people, who are the community leaders that we can work together, how these things, AI can learn from them. And things also a change, as the political context change. Now, COVID is not that of a topic, but other, health-related information when surfaces up, people start associating that with different other groups. And also to coming up with AI models that are more pluriversal in nature, how we can add context and explanations to that. So it's kind of like a back and forth system where the community is learning from how the technology behaves, and technology is learning how the community reacts. So for me, that's something what I want to call community-aligned AI, but that's also describing the problem, not the solution. So we are also learning at very early stage of this project. Thank you.
Jude?
Okay, thank you so much. What does culturally relevant AI mean to me? That's a very important question to me, and it touched the core of why I do the work I do. So I was born in a very tiny community, really far away from the central system. When you think of the most remote community, far from the urban system, that you will never imagine that's where I come from. And if I say I've never been to a doctor before I ever moved to Italy, that's true. And my situation was not unique. In order to go to the doctor in my own community, and again, this is not a generic situation where I grew up, but to go to the doctor, you need to be at the point where you're almost at the point of dying. Otherwise, you self-medicate and you move on. And then at that point when you're almost dying, when you get there, there's just one family doctor who may be away. And then you are asked to move to a nearby hospital, and the roads are not good. And by the time you drive to the nearby hospital, somebody will die. Again, I do have experience of my aunt or other people dying behind my back, and that's what passionately, when my dean mentioned about me being passionate about what I do, it's about it being personal to me. And when I got to realize that instead of relying on the central system to create tools that are reactive, I can use what I've learned to create tools that are proactive, such that people in a community like the one I grew up in will be able to know of something and react to it ahead of time. Because if something were to happen to my community and everybody get arrested, nobody will ever care. It will not make news anywhere, just nothing for somebody to bother about. And in such communities, there are realities that are completely different. Where someone like me raised by a single mom, 5 kids or more, sleeping in a single bedroom, if there is a disease, everybody gets to be infected. If there's a flu, everybody, I'll sleep with my sister on the same bed, everybody gets to be infected. It's easier for misinformation to spread, where somebody will just run and say something, and you don't have to verify, and you jump on it because there's no other relevant information, scientifically proven information that came before that misinformation. Once that misinformation jumps into the village, you're able to pick it up, and especially on someone that's from the community. So to me, the idea of culturally relevant AI means so much to me. What does that mean? To me, that means locally relevant to the community in question. To me, that means responsible to policy and regulations. To me, that means explainable to the whole society at large. And for this to happen, local dynamics needs to take in place. It will not be culturally relevant unless local dynamics, the cultural dynamics are integrated into it. And for those cultural dynamics to take in place, you need to understand those cultural realities by having diverse group of people, people that understand the dynamics, understand how that misinformation spread within the community when the time comes. And I'm grateful for the Institute of Pandemic that have people with different experience, from different backgrounds, who have different expertise, that are able to share these different expertise to build such solutions to address misinformation. And thank you, Nelson, for your leadership.
Thanks, Jude, and thanks everyone for setting us off so strongly with, really diverse, but also aligned approaches, I think, and perspectives on what culturally aligned, culturally relevant AI is and where it might be taking us. So I'm going to address this question back to you, Jude, if that's okay, and really think about, I think one of the concerns we have in the digital environment generally is that algorithms might be separating us into completely separate media worlds and spaces. And at the same time, we want tailored approaches for communities. So how do we find the right balance between being polarized algorithmically, but also needing to do some tailoring, and then also trying to find a way to stay together and have a sense of community?
I really appreciate that. When something happened like pandemic that we had, we need to create a place where a diverse group of people, not just academics, but different communities that have different experience, that can come to articulate the dynamics within those communities. And within the Institute of Pandemic and within group I lead, the Global Artificial Intelligence for Pandemic and Epidemic Preparedness and Response Network that's based at the Institute for Pandemic at our school, you are able to bring communities, in different communities where you have to create a solution, culturally relevant solution for communities to adopt. But before you get to that point, what we do at the Institute is you're able to identify the key leaders in those communities that we work with, bring them on the table and listen to what the problem is. Once you listen to the problem, you plan with those communities as to what solution is needed. Once you plan from them, you are learning at the same time. And then you are using your knowledge to co-create with them. Again, you are not the expert there. The community members are the expert who understand the dynamics within the community. You would not go to any community and say, this is your problem and this is your solution. Once you get the community on the table, co-creating with you, like what we do in my organization, that's when you create something that the community will realize that, well, this will solve their issue because they co-created with you. They presented a problem to you, and then you co-create the solution with them. So to get to that point is more around bringing communities on the table, bringing diverse group of scientists on the table, and then learning from the communities, planning with them, co-creating with them, and acting with them, such that if we have something like a pandemic, in the absence of scientifically proven information, there's relevant voices that are getting in there, counteracting the misinformation that may be spreading along the way. And so the only way to do that is have institutes like what we have and bring everybody, communities all the time, to have a conversation with them.
Who wants to build on that and really help us get into that question?
Yeah, I guess Jude made a really good answer to the question. I think one of the core questions regarding that is, and which is important for us to ask is, whose AI or whose algorithm is it? A lot of times when we say there is an algorithm and it's not working for us, it sounds like that algorithm is coming from someone else. So there is this whole idea of data colonialism out there. And the funny thing is that they are actually working on our data. If it's our data, why isn't the algorithm our algorithm? Where exactly things go out of our hand? So that's kind of the question that we need to, ask. Like, if it's our data, why it's not our intelligence? Why is our data being produced and captured and used and misused by people who are not us and who are basically telling us what to do and how to do, and oftentimes that are not aligned with what we want to do as a community or as an individual. So these are the questions that, that we have not yet started asking, I guess, but we need to ask, because some of the things that now we're seeing, we are obsessed about, AI is coming up with new and new technologies and everything. I sit in computer science department, and don't get me wrong, I'm incredibly proud of my colleagues. We got Nobel Prize in artificial intelligence. We are the best, and as much as I'm proud of the progress that we have made with AI, at the same time, I'm concerned that much of the benefit of the AI right now is probably going to the corporates making profit of data. Much of those was not collected ethically. So we have to take control over our data. Data sovereignty is very important here. We need to build a civic data trust, so we can then tell, if you work on our data, then you have to go by our rules. So these are the some of the terms that we haven't yet made, but these are very important for us to advance this kind of conversations. We need to start from that question, like, whose data, then whose intelligence, whose AI we're talking about.
Dan?
So earlier this evening, I mentioned that one of my great U of T colleagues here, Laura Rosella, is not here this evening, but I'm going to channel my inner Laura. Because if she was here, she would say, yes, public health needs AI, maybe, but AI needs public health. And the reason she says that is that the idea, the concept, the motivation for community engagement, being responsible, being respectful, being culturally responsive, all of these things are things that are just like a Tuesday for public health. Like, it's a very normal viewpoint, skill set for somebody working in public health to have. And I think that that's what I was trying to get across earlier, is that people know how to do this. They know how to do it very well. I think there's a really important capacity building piece among, let's say, technical people, to expose them to these ideas, these viewpoints, these skill sets, because we know how to do a lot of this stuff. And I don't want to trivialize it. I'm not saying it's easy. I mean, the community engagement is a two-word phrase that does a lot of work. So I don't want to trivialize it. But neither is it the case that no one's ever done this before. So I think that there's an opportunity there for, again, this sort of interdisciplinary collaboration and pedagogy for more people to learn how to do this.
Thanks. And, okay, so my mind is spinning in so many directions, thinking about like how we can take an appreciative and strengths-based approach to this, looking at where communities are experts in community, right? Where public health is experts in working with community and really taking that approach. And then AI experts are leading us into a potentially strong new future with lots and lots of potential, right? If we can find ways to build relationships. So I'm going to go right back to you again, Dan, and tell me a little bit more about, pedagogically speaking, or within the academy, how do we do that? How do we build bridges across disciplines?
Oh, it's just like an easy question. No, I really appreciate that. So I think maybe it comes back to what do we want. Okay, so there's lots of different contexts. We could talk about pedagogy. We could talk about like students at university, for example. We could talk about people working in the field. Maybe let's talk about students at university just for a bit. Sure. Try to get my head around this. So I think that there is a move, and we were discussing this earlier, for the importance of doing this more, but providing a more complete and well-rounded education for students in technical sciences, computer science, engineering, related kinds of fields where, and I'm not talking about like, oh, everybody should get a course on public health ethics or something like that. I think what we need to do is make it pervasive. I think that when we are providing technical education, there's lots of opportunities to use examples. Examples are so helpful. In fact, they're really helpful when discussing AI tools because there's such a breadth of possible AI tools we could be talking about. So I think that maybe one way forward is when we're doing technical education and we have examples of applications, which we often talk about when we're teaching, to not have those examples be presented as like a little extra add-on something, but to be kind of fulsome and have depth and to have that conversation about, this is an example of an application of AI that might be interesting, and here is all of the context that makes that a feasible thing to do, and all of the groundwork and all of the background that you would need.
Anyone else want to jump in?
So I can add a small piece to that. I guess the point where it becomes really challenging, I guess, and I have seen this in many academic setting. People are very well intended. They want an interdisciplinary dialogue. So they bring someone who is doing computer science, and they bring someone who is doing law, someone doing social science, someone doing an arts, or and this is a table, and then they believe that, okay, this is an interdisciplinary table, so something good, something interdisciplinary, all of a sudden will jump out of it. But it doesn't work that way because these people do not speak in the same language. There are epistemological, a difference. There is a, methodological difference, and it requires a very careful interdisciplinary skills to teach these disciplines together. So I guess for a university, if you're talking about this pedagogical innovation, we need to spend more time on the sort of things that Dan was saying, what a public health is good at and what computer science is good at. Computer science is good at scaling, a service, and public health, social science, anthropology, they are very good at going deeper, contextualize something. How can you, bring these two things together to, combat the problems that we are facing right now? And I believe a lot of design work is important here. A lot of, community awareness sort of things that are important here. Maybe, an avenues that we are not thinking about, maybe art, maybe, other disciplines can be helpful in making that bridge. But definitely there is a gap here that we need to find out how the gap, how big the gap is or where the gap is actually located, and we need to work toward that.
So if I were to add here, I want to share the experience at the Institute for Pandemic. And what I found there is based on the learning that we have from the Global South, our work in Africa. We were able to really work with communities and government to address the pandemic and universities. And the way we did that was far from us sitting in the university offices, having colleagues in universities in either South Africa, Ethiopia, Cameroon, Ghana, and create solutions, and then go to communities and say, this is your problem, and this is a solution. Nobody will adopt that. When I joined the school, I realized that the thought process at the Institute for Pandemic aligned exactly with my vision and the way I do my things and the way what got me into science, where you are a tool alongside the community to learn from them, to fix an issue. And it's just one screwdriver to mount a coffee table. There are multiple screwdrivers. And so to get to that point where the coffee table will be standing ready, you need to bring multiple screwdrivers from the university that will be able to use the wood that came from the community, the problem that came from the household, to be able to have a coffee table. And that's the approach we used. And we have learned that to be able to use AI the right way, at the Institute, we need to be able to speak to different disciplines. You're in computer science, we just submitted a grant. to work together, and social scientists. And that's the approach that Institute of Pandemic used, where we bring communities, different communities around Canada, they articulate their issues. And then we bring different scientists across the school and across the university to say, what tools can we pull together to address this while learning from the communities and co-creating this with them. And so the only way to break silos is when you bring people that are passionate. The word passionate here is very important. People must not be doing it for their grant. People must not be doing it for just to be happy for their research, to say my research. People need to do it because they care about the communities. It should be personal to them. Once it is personal and you bring those people with personal issues that care about an issue, and then somebody from the community come with that issue, a solution will come true. But otherwise, it will be different. And that's the approach we're using at the Institute for Pandemic.
I want to pick up on that idea of doing AI in a good way. And Ishtiaque, I'm going to come back to you because you used some big phrases here. Data sovereignty, resisting data colonization, and building data trusts. These are big and optimistic ideas, and I'm wondering, do you have any examples of promising practices where people are doing this well or could be?
I just got the grant this morning from the School of Cities. So maybe in 2 years, but no. Okay, okay. So we have to, if you want to address this problem probably, properly, we need to start with some, understanding. Right now, AI is standing on some kind of objective, secular understanding of the world, and it's kind of working in a way which we have criticized for years as historical determinism. If you think about data, it's the fact about the past, and you are trying to do something or predict something for the future. You're building the future world based on your understanding of the past. Now, all the criticism that we know about this kind of reliance of the past, which is on the partial data, biased data, and also this kind of understanding that history works in a linear way, all these problems are embedded in AI. Now, social scientists know this for hundreds of years. All the things that we are now seeing in AI, these are not something that, an unexpected to some extent. So, finding the problem is probably, not something, groundbreaking. Where things get a bit more, complicated is, and I can, adding to, Jude's point, I think I can also add some examples from Global South. So I'm from Bangladesh, and a lot of my work, consists of doing ethnography in rural Bangladesh, and a lot of those was with witchcraft. So witches, they provide healthcare service in this part of the world. So there is also modern hospitals, providing people a modern healthcare service, but a lot of people do not go to those hospitals. And we ask them the question why? So the answer is something which allows us to think about the way AI works in a deeper way. So one thing is that they say, well, the modern doctors, if my hand is broken, they can tell how the hand was broken and how it could get fixed, but they can't tell us why the hand was broken. So I say, that question itself was even an alien to me. I mean, although I grew up in Bangladesh, I grew up in the urban part. I was schooled with all Western, scientific education. So they say that, well, I must have done something wrong. Otherwise, and what was that something? So the witch actually goes into an history and say, well, definitely you got into trouble with someone, or you were not careful in walking because something was scared. All these things actually make sense. Why did someone actually fall? And they say there's the kind of solution, there's a long-term solution that you can get from the witch. They do not only fix your body, they fix your mind, they fix your society. And that's the kind of more sustainable solution that so now you see you can say that this kind of a witch, you can put that as an orthogonal to modern science, and I'm not saying that in some cases it's not, but then also there is another way of looking at it, how you can have both of them working together. And these are the things which also come up when you think about how AI works, for example, like prediction. So like the way we predict weather. So there's like classic example where we set up a weather prediction app, which was telling the farmers that there is going to be a rain, like later this week or something. They didn't have the app, so we would, the NGO people would go to the mosque and they would announce that from the mosque. So the imam of the mosque, he said, no, you cannot do that because you are predicting the future, but our religion says only God can say what future is. So what AI is doing is fundamentally, like an against religion. So these are the hard questions, and we had to, go deeper into this. What is future to them? And, how it's defined with, with religion and, in the society. And then we started, gambling when people, at the same time they're gambling, and they're not gambling based on statistical, a probability. They were gambling, and then they are praying to their God, and they think that only God knows what the future will be, and there is nothing you can do with your math, doing math on your data, or what we call AI, to tell you which team is going to win. You call God, and if the God is pleased with you, they'll do that. So these are the the fundamental differences. Even with when you work with communities, this question will come up, and designing AI or technologies with the community will fundamentally reshape how AI will look like. So if you go there with a mindset that we want to, expand the, a world of AI, well, we are going to help them with our AI. That's, fundamentally a colonial approach of doing it. The decolonial approach would be to, let AI learn, or let, yourself learn how they think and how we can help them do what they want to do, how they want to live, with whatever we can help them with. So to do that, all these, tools and technology, to how we can protect their data with, a data trust, giving them data sovereignty, which is also a movement. We are aligned with the indigenous communities here in Canada, and we have a global alliance for that. It's not only about data, how the, causal reasoning coming out of the data, all these things that we are doing together is part of that conversation.
Jude or Dan, do you want to weigh in on that?
Okay. I love your example, Margot, and I would like to say that when the colonials, in the colonial way of doing things, the colonial master wants you to realize that he's here as a savior to serve you. And you brought the idea of being able to forecast the future, predictive modeling, where people will say it's God alone. And when the colonial master came in and was able to do things that happened, will come to happen, people tend to realize that this was so inspirational. Oh, this is like God coming in. The way to decolonize research is to be able to sit with the communities, use community knowledge, have people from the community build that tool. If they build the tool themselves and they are forecasting, they will not start questioning that because they built it, they were part of it. That will empower them. They will get so excited that they built something that's used to solve issues in their community that they never thought that could happen. And the moment they build that and their policymakers pick that up, it gets them more excited and more passionate because they see that my work is being used to help my community. Everybody in every local community wants to solve the issues in their communities. And when they sit with the community and build a solution, and the government is there to reinforce that, they get more passionate and that continue. So the way to decolonize research, be in the country, is have community voices, have government sit on the table, have researchers learn from communities, co-create with communities, act with communities, and the government implement what is coming from community members. Once that happened, it empowered them. Then you will completely move the mindset from relying that technology can come from colonial masters only to a point where local people in local communities will be able to create technologies. I'm here with a lot of colleagues that have worked with me in different communities in the Global South. And when there's an outbreak, a pandemic in the Global South, they rely on London School of Hygiene, on Johns Hopkins, or on us here. But what we have been able to do from the Institute of Pandemic, from when we created the Canada Africa Artificial Intelligence and Data Innovation Consortium, was about change the mindset, where countries would not rely on Centre Pasteur French Institute to solve the issues, where they will not rely on Johns Hopkins, where they will not rely on London School of Hygiene, but you empower local communities to sit together with their researchers and build solutions. At that point, it will be adopted. Once you decolonize research, the problems that we have that spread over will not exist because there's uptake. People feel that I'm part of this, they understand it, and they will use it. But if you impose it on them from a foreign tool in a very colonial way, they will take it, but nobody will use it. That will be irrelevant. We have proven that, and that's what we're trying to do within the Institute of Pandemic, where we work with communities here, co-create tools with them so that they can be able to adopt that.
Dan? Okay. There's a lot, right? There's a lot to think about. And so one of the things that really occurred to me while you two were both speaking was really the ways in which, and Ishtiaque, you really said this, AI contains multitudes and contains the structures and systems that came before, right? Which is a very Marshall McLuhan idea, right? Every technology, the new technology contains the old ones within it. And so we can see in which, the ways in which it contains all of our biases, all of our structures, all of our ideas about epistemology, and even axiology, our values, right? What we care about, encoded in there. And so I'm feeling in that a bit of a contrast between the time it often takes to build trust in community and do community work, and the speed at which AI is rapidly changing things. Ishtiaque, before the event today, you were talking about guardrails being removed from the use of AI in some contexts and in some companies.
In some country.
In some country. So I think, so the question for me in all of that is, what's the role of policy and regulation to help us navigate something that's changing so quickly when we value doing things maybe a bit more slowly?
Great question. I guess well, it's a part of like a longer discussion, but I think first, I want to mention a couple of things that might be like more relevant to this audience. One is, there are different ways we can think about, an AI. And one way a lot of people are thinking about, and they think that is a right way to think about AI, is that AI is a tool, and it's not going to replace humans. It's going to make humans work easier, more efficient. And now, if you think about a tool, the thing that we learned from Heidegger, all this phenomenology, how a hammer works and tool works, you need to have kind of like a faith. If you are a doctor, you are using a tool, and you are doing a surgery, you know how much trust you are putting on this tool when you are doing your surgery. AI is going to be that kind of a tool, and that kind of trust you need people to have in it. Now, and for that, there needs to be a lot of standardization, guidelines, and rules, so you know exactly this tool will be doing when you are using the tool for solving a particular problem. This is where a lot of rules and regulations need to be put in place. In Canada, C27. Unfortunately, was not. Well, it requires some, a modification. But
tell us what C27, so everyone can keep up.
So C27 is, among others, it is about responsible AI. How you can make AI responsible and accountable. So it kind of tracks the whole journey of AI, like a whole AI pipeline, and makes sure it's not violating privacy. There's no a copyright violation, no, unfairness issues, and a lot of other things. And definitely, it's in a lot of industry people do not like it because it's basically telling them to do more checking on their AI, which will make their AI more expensive and like a slow. Now, but there is no like a shortcut way of, as you say, like a building trust, making tools perfect, other than like taking that time to make the tool perfect. We are like seeing this madness in computer science industry to some extent, even in academia, especially now with AI, that like they have like different phrases for it, like breaking it, or like none of these things are like goes very well with the sentiment of safe and like unsustainable community trust development things. So we need to put our own guardrails. Like if the guardrail is not coming from AI, we can still put the guardrails in healthcare, that if you want to use AI in healthcare, you need to follow this. So that's where, and these guardrails definitely, like borrowing from Jude, should not come from like us, we being the, like a colonial health provider. It should come from the community, with a conversation with the community.
I like this question. So I don't know if anyone here remember tractors. Who knows what a tractor is? So I come from a community where, despite Industrial Revolution, a tractor has never existed in my village. So if you put a tractor in my village for my mom to use in the farming, we hoe our farm by, nobody will ever use a tractor. Because nobody knows what that's used for. Nobody will ever use a tractor. But that's what changed Industrial Revolution. But with cell phone, mobile money, I'm able to sit here and send money to my mother who doesn't have electricity at times in the village. And they're able to be able to acquire that. In local villages with no electricity. And so when I think of, in this Industrial Revolution moving forward, I start asking the question, what happened in that era of tractor vis-a-vis phones, where my mom in the local community is able to benefit from cell phone, but even up to this Industrial Revolution, if you give me a tractor, nobody will use it. And the question goes back to local relevance in the community, cooperating with them. You come to a community where nobody has a car and then you put a tractor, nobody ever use that. It's not locally relevant to them. How do you ensure that you're not moving with the hype and trying to follow the buzzword that exists and co-create tools? The important thing is going to each community and finding out what is culturally relevant to them, working with them to create what they need, rather than trying to ensure that you made up with the speed. And that's the way that we try to solve those issues.
Dan?
I may have kind of forgotten the question, but I have a couple of thoughts about
Share
regulation.
your thoughts.
Okay, quick aside. If you haven't read about the history of the stethoscope, find a credible source and read about the history of the stethoscope as a tool, a technology that's interposed itself between a doc and a patient and how that was received and kind of what happened. It's a great story. Okay, so I have some thoughts about values. So the use of AI kind of feels like something that's happening to us, like without our volition. It's not something that we have control over. We have a lot to learn from colonized people, because I'm not saying it's the same thing, but that sensation and how to deal with it is something that's been imposed on other cultures for a very long time. So I think it's important to recognize that when it feels like this is something that's being imposed on us and that we don't have control over, to remind ourselves that AI and the way it's used is in a large part a question of values. We express those values through the systems of governance and the social structures that we have in our society. Call your MP. And I'm not really joking, make it known that you value, make it known what your values are relative to this as a thing that's happening to us, because it doesn't have to be a thing that's happening to us. So I'd like to just say a little bit about inevitability. And I was talking with So I'm friends with a lot of family physicians, which is great. Primary care is a wonderful place. And we were talking about AI tools in that context, and he said, would you stop, not to me, but would you stop automating the parts of my job that I like, please? Like, I like those. I like interacting with my patients. I don't care if it's more efficient to have a tool interpose itself between me and my patient that's going to let me see 10 more patients. I don't care. That's not what I want. Stop trying to do that to me. And I think that those value questions are the only way forward in terms of navigating where does AI bring great benefit and where do we say, you know what, we don't need that here.
Okay, I hope you all know the phone numbers of your MPs. You probably have them on speed dial. We do. We need to take some ownership, right? As community members, as citizens, big C or small c citizens involved in our communities over what's happening. Everyone, I know your brains are reeling too. I'm going to ask one more big question and then I'm going to turn it to the audience. So start thinking about the question you want to pose to the panel today. I want to bring it back to misinformation and disinformation. And, you know, we're seeing a lot of geopolitical change. We do have that feeling of inevitability sometimes. What do we need to do to make sure that we can build trust in a context in which we have a really fragmented environment, technologically speaking, and the sense that people are investing in theories that aren't rooted in evidence or the kinds of evidence that matter to public health, but also that maybe some people are purposefully seeding disinformation. What steps do we need to be taking now to make sure that we can continue to build trust and safety?
Thank you for that question. I really love that. Mis and disinformation only spread in the absence. It could spread with, but in the absence of scientifically proven information, there's a vacuum that exists. And that was the case with COVID when it started. I was in a lot of platforms in Cameroon where people would say, if you drink Afofo, which is a locally made liquor, COVID cannot attack you. And they do that and they move around. Others who said in Ghana, if you drink a green tea, particular green tea, COVID will not affect you. That information was spreading because of the absence of scientifically proven information. And after COVID-19, we have learned from it, and that's one of the things that under nascent leadership we're trying to build, where you don't wait, but rather you start preparing for pandemics and addressing some of those issues. Where in the presence of a pandemic, you're able to have communities sitting with them and identify exactly, well, we cannot say this, but this is likely this. So that when that misinformation is coming, it will not be adopted. In my village, I will tell you, it's easier for misinformation to spread because it's very difficult for scientifically proven information to reach there. But if you create a forum where the communities are able to learn from scientists and understand the dynamics, then you block that misinformation from spreading the way it's spread. People are likely to buy misinformation in the absence of useful information. If there's any other information that counteract that, then that is bound to restrict the spread of that information. So the way to avoid misinformation is, let's work with communities like we're doing with the Institute of Pandemic, building those framework where communities come and co-create models that solve their issues. If there's an outbreak, then the scientists that are present listen to communities on how things are going, and they're able to address that. If information is not yet available, you are transparent to the communities.
Yeah, I guess this is a great question, and I guess we all are kind of trying to find the answer to that question. I'd say a couple of things. What Jude said is absolutely correct, that there's a, scientifically proven, an information, and, you check whether the information is aligned with that or not, as a great idea. But I also want to add to that is the world is made of atoms, but the world is also made of stories. And so if you just take what's scientifically proven and then wipe out everything from internet, you will lose all the fictions, all the novels, or all the fairy tales. and even the religious books. And then what you will find there is not something that you also want to only live with. We also, need stories to live with. So I guess a part of that, this misinformation and disinformation, and what makes it problematic is adding political context to that. And this is where the community engagement is super important. There are things that we know, black and white, it's from science that it is, right or not right, or what, a science says about this. But then what is now important for this community in this particular political context requires a deeper understanding, which often comes from the community. And this is where, to build that kind of trust, you need people from that community. It's not like you go there and you extract that knowledge and you put that in. No, it doesn't work that way. And this is where the community ownership is important. Community ownership over data, community ownership over algorithm, community-owned AI. These are the things that community trust more than a third party that they don't know what is going on, that magic box that they call AI is talking to them. Building trust to that third-party box is difficult. So what I think might be more practical, feasible, is to, a kind of a homebrewed AI sort of things.
Maybe I'll just come back to relationships. So I know the least about misinformation and disinformation. However, it does make me think of a conversation I had with a public health nurse, and we were talking about, she was saying gee, I'm not totally sure where the new moms in my catchment area are getting their information. And we were talking about, well, probably social media and maybe apps and some other things. It was a great chat. And we kind of came down to I was like, could you just ask? And she was like, yeah, I could totally just ask. And so as part of, for example, well baby checks, they're gonna ask some real easy questions about so where are you getting your info, And so that's a case where that's a local health unit. They have that or want that relationship with the people in their catchment area, right? And so those orgs that have that expertise are maybe a sort of complementary way to the technical things that we can do to combat some of that.
Okay, everyone in the room, now is your moment. There is a mic at the back of the room. And here comes our first question.
Hi, my name is Noshaba Degeti. I work at the Canadian Mental Health Association. Thank you very much. This has been really interesting. We obviously in mental health and addiction work with very marginalized populations, and one of the things that I'm struggling with, and I think it's a challenging time we're all living through in terms of, to echo the point around misinformation. And I think it's important that we create space for cultural narratives and conversations. How do we weave that together with creating a common narrative that's based on evidence? Because I think this is one of the challenges we face, is that everyone has their own narrative. And to your earlier point, Nicole, some of it just silos us. How do we break that down? And whether it's AI or it's the conversations, I think we're relying on AI to do something that I don't know that that's what AI is going to do. So what do we do to initiate or advance those conversations?
Yeah. Okay, I can take that question. I think this is a great question. I have my version of the answer to this question. So I agree with you. It may not be the responsibility of the AI to, if AI can do that, that's great, but that's not essentially the responsibility of AI. Instead, the silos that you're talking about, the more feasible and I guess a kind of responsible way that AI could work is probably to empower those silos, and probably starting from there they could inform them what other groups are, thinking about and talking about to facilitate these conversations. But if we think about, using AI to, foster that kind of a conversation, the risk that we will be running is that the group which have the majority of data, like majority of the people, they will start to dominate. As we have seen in over internet, even over Wikipedia, a majority of the people are coming from a particular part of the world, and then the conversation, what they think right or wrong, they were pushing their ethics over the ethics of other people around the world. So that's the risk that will be running then. The other problem with a related problem, I would say, is that even before 2019, we are only thinking about AI as something that consumes information. Where out internet out there in internet, or what we can put into the machine, the AI is trained by that, and then it helps you with doing something. But now this generative AI is also producing information. So the information that you now see on internet, some of those were produced by humans and some of those are produced by AI. Now, the new AI is being trained by the output of old AI. And soon it's, has, this autophagy thing happening, and it's, we call this a model collapse thing. So you see how quickly the AI could converge into something which the majority is saying. So it's going to be a very, a dangerous tech at that point. If that answers your question.
So that's a very good question. I want to use your question to narrate something that's happening in our country and bring that to our communities. I listened to a minister yesterday talk about us having 10 economies. And it's not just that breaks into the fabric of every industry within our country. Animal Health Canada, when we talk of One Health, Animal Health Canada does not speak to Public Health Agency of Canada. The Public Health Agency of Alberta does not speak to the Public Health Agency of Ontario. And if we want to solve issues across this, we need to figure out how do we learn from different data sets to be able to address this issue, because they are interrelated. We are one country, people are related. It speaks them to the mental health issues that you are looking at. Different community health centers, rightfully on their data, but by how much do we train models, if we move to that, to be able to learn from all of these? One thing we are doing at the Institute of Pandemic is my lab in particular have a lot of expertise that look at federated learning. How can we be able to allow those communities still on their data set, and at the same time we build a model without taking a data set that is able to speak across it, to be able to learn from the different data set? And that's the way forward, even across the country, across our community. Federated learning will be able to be key to be able to listen to different communities and build that. We are doing that, but the hope is that we build that across the entire community on different issues and across the entire country. Thank you for that question.
Thank you.
More questions?
Yes, good evening, and thank you very much to all the panelists and the chair. Just a question, I hope I didn't hear it out of context, but a comment about the wellness visit being a wonderful place to ask, moms where they get their information. Is that what? Yeah, what struck me, and I don't know if I'm at all correct, but there's also a big danger in that, isn't there? Because if the mom says, I get my information from a MAHA network, will that pediatrician engage the mom, dismiss the mom? Does she have time to engage the mom? And I think that one of the problems that we got ourselves into, and I've been thinking a lot about this lately, and that's why I came tonight to learn more, is that if we don't engage, many will turn to those that will engage them, like RFK Jr. And the crunchy moms are finding a place to ask questions. So just with that as a statement, maybe you can help me understand if I'm off base, or do you think that there's some truth to that?
Just, Dan, before you jump in, just to clarify for everyone, MAHA means Make America Healthy Again, right? And it's the slogan of our
yes, that's correct,
in
yeah.
the U.S. Okay.
I hope as public health professionals we know that, yeah.
Thank you. So that's a great point. And I think one of the things, okay, the thing that it makes me think of is, so like I'm a computer scientist and like a statistician and like half an epidemiologist, kind of. And I'm not going to ask a new mom where she gets her information. I work with organizations that I think are amazing, including this one. And I think I have to put some trust into the operations of that organization and their values. And they're my surrogate, like I trust them that they know how to do that in a way that's not going to do exactly what you're talking about. But I mean, I totally agree. And I mean, I abridged the conversation, but when I was like, could you ask? And it was definitely not like, oh yeah, totally. It was a bit more like, oh, okay, so who do I have to ask to figure out if I can ask? And we did have a conversation, but like, is this gonna put people off? One of the things we're gonna do is like, it's gonna be one question, and it's gonna be like real, yeah, it's supposed to be very low key. But I think you're absolutely right that that relationship between public health nurse doing this well baby visit, like that's more important than finding this out. And I think that was part of the conversation that we had, that org, you know, is thinking about these trade-offs that they have to make, where it's like, we got to have buy-in. We also want to know what's going on. Let's think about whether taking this action is going to be a safe thing for us to do. But I really appreciate you bringing it up, because I do feel like there's often a sense that like asking for information is free or has no causal, yeah, thanks.
So I want to say that communities, if you create small communities that break silos within our school or within different research group within the school, they get different information, and then when they go back to the society, they get other information. Because they were involved in the creation of scientifically proven information, that part of it will be more stronger in rivaling the information that they are getting from somewhere because they distrust of the system. When they get out into the community, if Maha is saying something to them, and they know what they have seen, that they co-created with you is completely different, they will trust in themselves. Community knowledge is very powerful. The fear is when we don't integrate that community knowledge. Then JFK is able to spread the information because it's spread with force, with passion. But if you get community involved to create their own knowledge, to understand the reality, their own force will counteract JFK because they trust in themselves, they believe in themselves, rather than important knowledge. So the issue is still about breaking that silos and us moving from a point where we think we know better than communities, where we think we're smarter than communities, to a point where we realize that communities are very smart and we're just a tool to support the community and work with them to create information that the community will adopt. That is where we'll get to a point where the Mahan information will not counteract our information, but we're still lacking in that direction.
Let's take another question.
Thank you. Just as we have countless scientific articles in scientific journals that no one has read or disseminate, and therefore no decision makers implement in public policies. What do you think is possible? Same will happen with a lot of knowledge we have now with scientific AI health groups, and anybody reads, or just misinformation is higher than our real information? What do you think if we can include more journalists, more marketing like that in disseminate our real information, for example? Thank you.
So the question is about the risk that the knowledge and learning that we're developing here will end up in journals that aren't read, not disseminated, not shared with decision makers. So how do we make sure that what we're learning is used and useful?
there's distrust even in communities. If you read any news, a lot of communities that we care about will not believe in the news. And that still speaks to how do we empower them to be on the table? Bringing people from those communities. There are a lot of communities here in Toronto. The Black Creek Community Health Center is one of them that I really admire the way they do their things. They have community ambassadors that move from door to door, understand the local realities. And these community ambassadors every week sit down with scientists. I'm one of them that I sit with them. And they present what they are hearing. And these scientists present the right information that's supposed to spread. And they move around. What happened there is that if I go to my community, people will trust in me. Any information I say, if I go back to my village right now and say anything, no matter what you come and say, people will believe in me because they knew me growing up and they know who I am, where I come from, they understand me. That's what happened in communities. If you leave them out and then you give them the news, there's distrust. But when you get local communities involved and the information is spread by them, we're able to counteract that information. Journalists will still be there to play their role. But we still need that local information to be part of the table in building the model and seeing the reality, and then we push them to spread the information in community health centers. I want to speak to the community health centers that we have in Toronto. People go there to cut their hair. People go there for food. It's not just health. And a lot of information spread there. So if we can make good use of the community health centers, be relevant to us. That's what we're doing now. We're building those relationships across Toronto. If you're a community health center, reach out to the Institute for Pandemic, and we build those relationships to work together between different transdisciplinary academics, industry, and the communities. And that's the only way we'll be able to counteract the information that people like JFK will be spreading. I'm not saying JFK is spreading misinformation. I just want to say that.
Yeah, I can add to that. So I guess like this kind of top-down mode of knowledge mobilization, like scientists discover something, they publish in journals, and how the journalists can, get those information from journals, and then, how we can get down to community. This is super important. But what is also important is to think about how information which are within the community can go up so that the kind of research that the scientists are doing at the top, they know what problems are important for the community. I think this bottom-up channel, this is something that we need to put more work on, and this is where this, this community-aligned AI, community-aligned health research, all these things are kind of coming from that spirit. So I guess both of these two things are important, and I think the information flow from the bottom to the up is something which is mostly broken in our society. So yes, agree with everything. So journalists may also do this thing too, get this information higher up, probably.
And I think there's an important place in pedagogy for the issue that you're raising as well. So health communication is a whole discipline. And I think making sure that we're providing, when we're training public health professionals in health communication, that we're equipping them with the knowledge that they need to understand at least what's happening, and maybe counteract it. One of the things, I'm not stumping, but one of the things that we do at Western is actually we always make sure we have our media relations people come and give a whole session with our students about that, and we talk about all of those things, and it's really fun. Students love it, and I think it's very, I think it's formative for them when they're starting to think more about yeah, it really is up to me to get this information across.
We have time for one more question from the floor.
My name is Nelson Lee. I'm the director of the Institute for Pandemics. I'll take this opportunity to thank all the speakers and panelists in the wonderful, insightful conversations. I know very little about AI, so I guess I'm allowed to ask some not so smart questions. So when I think about public trust in pandemics and public health emergencies, nowadays we know that a lot of people are turning to AI to seek for the health information. So what if in future, when this happens and the information from your AI platform doesn't really align with the public health advice, and how are you going to address that? Will that increase or decrease public trust to public health advice? Does that sound like a reasonable question?
So, so I want to say that that will only happen if it was not co-created. And what you knew in the institute is that we are moving to a point where we want to have policymakers on the table, we have communities on the table, we listen to communities on their issues, we learn from them, we work with communities, we co-create models, and policymakers adopt the model from there. So we'll counteract the message if we work in silos. So the issue we're asking is, can the Institute for Pandemic build on what we're doing at different departments where we bring communities, we bring policymakers, and we co-create models with them to solve issues in communities? Once that happened, everybody will pick it up. Policymakers were there. They saw it, and they will reinforce it. We have done that in Africa. In Ethiopia, there was poliomyelitis. What we did was we built a tool for surveillance. In local communities where public health officers could not reach. And at that point, it's very difficult to distinguish just between regular paralysis and the one caused by polio. And when we built our tool, and the community started using it, by taking the image, and the government adopted it by enforcing and advertising it, it becomes something that everyone is using because the communities take the images, send it, and the government send a policymaker. So it becomes part of the system. Everybody was part of creating the solution. But if you created a solution without the government doesn't even know that exists. You don't expect them to start using it. The communities will not even know that app exists. How many apps do I have on my phone? How will I start using them? But if I was involved in creating that app, it's mine. I own it. I take ownership, and I use it. So the question that we need to ask ourselves is, how are we in the university really strongly working with communities and government? And as the director, I will pass that to you.
I love that approach because it really speaks to the need to go beyond learning health systems to learning health policy systems that really include community and decision makers, funders, government, together with research as part of what's connecting them, that we co-identify what we need to learn about and how we're going to use it and why it's important. We are coming toward the end of our time together, and so I really want to thank you again for being here, and I'm going to ask one last question to you that hopefully reinforces our focus on pandemics and being ready for the next public health emergency in a time when it could be pandemic, but could maybe be climate related, right? Could be political. There are so many challenges facing us today. Ishtiaque, you mentioned, you sort of alluded to that ethos in the tech sector of like move fast and break things. And we're seeing that happen in real time in the US right now on the political side as well as on the technological side. And so my question is really, that this is illuminating for us that what has been made can be unmade, right? And that we do have structures that maybe aren't serving us that well right now. And so if you could recommend one thing, an idea, a structure, a policy, a practice that should be unmade, or a new one that needs to be made to help us be ready for the next pandemic, what would you unmake, or what new thing would you make? I'm going to start with you, Dan. Oh, sorry, Ishtiaque, you wanted to go. Let's do it. Let's hear from you.
Okay, so I can start. I guess this is a difficult question, and I wish I had a good answer to that. A lot of researchers in my field, responsible AI, what they think is that it's super important that governments step forward and they make these rules, because with all pandemics there is this infodemics that also kind of accompany this disasters. The disasters are we know that it's more political than in anything that as a objective. So on that side, if you we have to play with the politics, not against the politics. And this is where, in a lot of places, the computer scientists are not equipped with the sort of like a communal politics that Jude is talking about, how to deal with that. Like even within the community, there are like gender politics and a lot of other politics. How do you, like come up with the policies on that? If I want to, like do or undo like a one thing, I would, make every computer scientist learn, like a political science or social science. I think that's very important for them, even before they start thinking about building an AI system.
Small question, big answer.
Okay, break silence in universities. The issue of grants within universities is killing research, where one faculty school will think about the school itself rather than about solving the problem in the community. If that can be broken, those silos is very important, where we don't care about what is it for, but about the community. The university not just going to the community to use them in their grant, to move from that point to really be passionate about the problems in the communities. Go to communities really when they care about the issues in the communities. Money should not be what is driving this, and that's the problem. Where universities go to community, get the grant, and then they stay away from communities and only go there when they're applying the next grant. That should be undone. What do we need to do? We need to only care about an issue that we feel that will solve a problem in our communities. What should drive our research should not be, I need to get this grant money, but rather, people are dying in my community when we have diseases. Can I be a tool used by my community? This relationship needs to be built. For this to be built, a lot of communities do not trust universities. For this to happen, we need to create institutes, see how we build relationship between researchers across the university and the communities. Regular meetings, regular relationship. It's very difficult, but relationships take time to build, but we need to move away from thinking about our impact based on our grant and papers towards what is my community issues that I'm solving, and is it a problem brought to me by the community? We need to learn from the community, plan with the community, act with the community. Again, I always repeat, nothing about the community without the community is very important. Otherwise, no problem will be solved.
Thank you. Thanks, Jude. Okay, Dan, bring us home.
I think that anything that can help us come together around knowing what our shared values are. When we're making decisions, especially at the policy level, there's evidence and there's values. If you're making a decision, both of those are inputs. I like to think that we have more shared values than we realize, and that doesn't need to squash diversity of viewpoints and experiences and all of the good things that make us different. I don't know what we need to allow us all to loudly express those shared values so that we move together in a good way, but whatever that is, I would like to make that thing.
Thank you so much, Dan, Ishtiaque, Jude, for sharing your insights and helping us think about what our next steps need to be in making a safe and culturally relevant, culturally tailored approach to using AI in a good and responsible way. Thank you everyone here in the room for being here. Thank you to everybody online for joining us. Just as a reminder, this will be posted online through the University of Toronto's channels with closed captioning, so stay tuned for that. Remember that if you're here in the room, you can stay and join us for a bit of a reception afterward. Don't forget to follow the Institute for Pandemics and the Dalla Lana School of Public Health on social media, LinkedIn, Facebook, Instagram, and that other one. We hope to be with you again soon at other events. And I would be very remiss if I didn't also thank Dr. Nelson Lee, Ted Konya, Vanessa Smith, and all those who organized today's event for the Institute for Pandemics. Thank you again, everyone, and I hope to see you here again next year. Mic drop, literally. Thank you so much, both of you. That was great.
I mean, thanks for having me.
I feel like we were just getting warmed up. Yeah.